intestinal failure is really defined by the need for either IV hydration or IV nutrition. But the big thing here is you need intravenous help. The different causes, you may have a tumor, there may be trauma, inflammatory bowel disease. If your gut isn't normal, then it's going to cause other problems. So we work on helping them. A little salt, little sugar gets absorbed very, very nicely. It's called oral rehydration solutions. Think about physical therapy. You're reteaching certain muscles to work. Well, we're trying to reteach the gut, and basically think about your car. If your car doesn't have a motor, guess what? You're not moving. Likewise, if your motor of your GI tract doesn't work, you're not going to be able to be hydrated or be able to keep up with your nutrition. So patients like that end up needing help.